Danielle, is that up to everyone's screen right now?
Yeah, we're good.
Excellent. Okay, so I'm going to dive in. What to do if you have a COVID-19 outbreak. So I'll say a couple things from the start. First off, this is an unfortunate and irritating fact of life these days, right? It's a legitimate business concern that there could be some sort of COVID case at your establishment. I want to be clear though, we're using terms like outbreak for kind of convenience, but as I've said multiple times in media, it's not as though you're all off making the virus in your secret underground laboratories and slipping it in people's cocktails. We're talking about those low risk potential exposures as much as anything else, right? But it's all kind of the same information, so we're putting it together in that context. We're going to cover some of the potential scenarios, like what if an employee has COVID, what if a customer has COVID, what if, should I stay open, should I stay closed, that kind of stuff. We'll be articulating some of the steps to follow that have been laid out in WorkSafe guidelines, public health guidelines, some general cleaning guidelines. Arun will be walking through some of that as I do as well. Employer responsibilities, worker safety. This is mostly where Arun is going to be helping you guys because, as I said, he's the expert. And I'll cover a lot about communications because that's more what we do. As I mentioned, we're WorkSafeBC. If you don't know us, we're a not-for-profit society. And as you can see, that's myself and Danielle, and what we work in. We have about 1,000 members throughout the entire province. And I'll talk a little bit about membership at the end, but I'll leave that alone for now. So in what situations should employees not come to work in relation to COVID? And Arun, I'm going to talk about a few things here. And if I miss something, please just dive in and say something. So first off, so when should employees not come to work? The real answer is anybody who is exhibiting symptoms of COVID-19. And they either have to self-isolate or contact 811 to find out whether they should be tested or isolated. These details should be covered in your COVID-19 safety plan, which will have the guidelines, policies, procedures, et cetera, and how you're managing this, and both your WorkSafe policies. To help ensure that no one comes to work with COVID-19, Dr. Henry, our provincial health officer, has been abundantly clear. You need to do daily workplace screening. That does not mean you have to take people's temperatures, and it doesn't mean you have to have anything serious in place, but you have to take seriously your obligation to check in with your staff and have them attest every day when they show up at your store, your pub, your hotel, et cetera, that they do not have COVID. And there's some great online forums, or there's one with the BC CDC that just asks those kind of questions. Oops. So an employee has tested positive for COVID-19. What should
Sorry,
you...
Jeff,
Yeah,
if I could just jump in.
Please.
You know, the requirement for the daily health check has been reinforced of late, and they want you to maintain records of your checks. So, when you're doing those checks daily on your employees, there should be some form of record which they can come back and check. So I just wanted to highlight that.
So are you thinking, Arun, like a paper form would be sufficient, or like an online app or something where they can just kind of keep a record?
Either of those could work. Some folks I know use forms that the people can sign off when they have people coming into their workplace, but I've also known people to use online apps, but also very simply maybe using a survey monkey survey as we use in our own workplace. I mean, when people go into our office, they actually go in and fill that out before they go into the office.
I see. And you would just have them select the questions and then you can save those results. Yeah, that's a good idea. So the next scenario would be, an employee has tested positive for COVID-19. What should an employer do? There's actually a lot of questions around this. And Arun's going to get into later on what you're allowed to ask employees and what not. But let's say an employee has been tested positive for COVID. So first off, they can't come back to work, right? They're probably at that point been contacted by public health and they know that they're obliged to isolate or seek treatment. So your first obligation is ensure that they do not come to work. And then anybody who's got symptoms in the last 10 days or is under the direction of the public health officer. You also have to immediately isolate that employee if they're around, and send them. I guess this would be more if they have symptoms. After you find out that an individual has contracted COVID, you have to determine who their close contacts were. And ask those employees, ask the person who has COVID, who they were in contact with. And close contact means within 2 meters in the past 2 weeks. And then speak to those employees and do a health assessment with them. You have to clean and disinfect the employees' workspace, any tools, anything they've done as part of their job. After that, you want to, once you figured out who those close contacts were, you want to go and talk to them. And then we've got some suggested messaging on that as well. And then after that, so it's kind of like circles, right? You deal with the individual employee first, anybody the employees had contact with, and then you probably want to communicate with the rest of your staff. We'll cover that after. Arun, did you want to add on to this? Not these particular points, this general question.
Yes, so this seems to, the approach also seems to be a little varied based on health authority and the region that you're in. So different health authorities are, based on what I guess the scenarios in that particular health authority at that time, they are recommending, maybe slight variances on what you suggested, but I think overall what you said holds true.
Okay.
There's also a couple, there's 2 questions in the chat if you want to just address them now.
Oh, could you read them out? I have to switch screens to make sense.
The first one, do we know how long those have to be kept on site? I'm not entirely sure what they were referring to.
Oh, I see. You mean probably the staff health check records.
Yeah.
I've not seen a specific requirement for the number of days that they need to be kept, but I would recommend that at least through this period, they are kept in, as long as the requirement exists, they are kept in check, because if in case there is an outbreak at your workplace or there's a WorkSafeBC inspection, they may ask to see these records.
If I were to give you guys a guess on that, I would say, we're always talking about like 2-week timeframes for an incubation period, but to be safe, double it and keep them for a month. If they haven't contracted COVID in the past month, it's not related to that previous health check, right? And what was the other question, Daniel?
Yeah, there's a couple of questions. I think we'll address them later, but basically, if an employee has symptoms, can they return with a doctor's note or a negative COVID test, or do they have to isolate for 10 to 14 days regardless?
So I think that depends on if they've actually gone in for a test, then it depends on what public health is going to be telling them to do at that point. It could be based on a recommendation given by 811, but eventually if they have a negative test, they can come back to work.
Right.
And another question, WorkSafeBC is asking not to inform workers at the workplace that a worker has tested positive. What would you recommend? Yeah,
there's privacy concerns about that a bit. Arun.
Yep. So this is where it gets a little tricky. It depends on your size of operation, is what I would say. If you have a small workplace and there's someone missing, I guess the staff are bound to infer that the person who's not around is probably the one that you're talking about. But protecting people's privacy in this scenario has been stressed over and over again by multiple agencies, including public health, WorkSafeBC, the privacy commissioner, human rights folks. So there's an underlying element of making sure that employers understand the requirement as far as privacy requirements go. So in that case, as far as possible, you don't disclose the name of the employee, but in smaller places that may be a little hard to do. But communicating about an employee being sick and what you are doing as an employer to address some of the issues that have come up because of that is something that you should do. You should tell your employees what you're doing to make sure that the workplace is safe. What have you done once the person is tested positive? What have you done to maybe address some of those cleaning requirements? Maybe relooking at your safe work procedures, your safety plan, and ensuring that you're putting things in place that can help protect them. So some form of communication is definitely desirable, because you can bet that employees are talking amongst themselves, and there is a sense of unease when they hear that something like this has happened at their workplace.
I just want to pause here for 2 seconds, Danielle. We seem to be having a small issue where Zoom is not letting other people sign in right now.
Yeah, I'm trying to resolve it. I've emailed the people back.
Okay, thank you very much. I appreciate that. Interior health requirements. Yeah, it says to keep those records for 30 days. Thank you. How do we find being in contact, being within 2 meters of someone? For workers' roommate has tested positive, is the worker allowed to come to work? They have been in close contact with someone who's exhibited, who has COVID, then they should contact public health and seek advice, right?
Correct.
Yeah. I'm going to pause for 2 seconds here as well, because a few of you guys are really hoping to get some questions answered, and you've texted some to me. So,
Gosh.
People are asking about the general public health orders, industry shutdown. Has there been any insight about further closures or new protocols from government? I want to be clear about this, and I know a lot of people have concerns about this. With the general caveat that my information about this is always valid for a week or two because things change so rapidly in COVID, right? But no, there's no new additional closures or protocols being aimed at the hospitality or liquor retail or accommodation sector right now. There was some about gatherings and events at home, as well as a new interpretation of how that means you can gather in hotels, like business meetings are not allowed right now. But there's no additional like shutdowns or anything coming. And then about mask use, someone's asking, how do you deal with a customer who says they are exempt from wearing a mask? I get that fairly often now because sometimes we're calling BS on that, but ultimately it is not your obligation to determine whether or not an individual customer coming in has any reason to not wear a mask. As long as they say it, you can just accept it. What we have recommended though is two things in this, and it's up to you. These are just my recommendations. I mean, the first one would be ask the customer if they'd be comfortable wearing a face shield instead of a mask. And then you could have those available either to give or to all your customers to purchase. Because if it's and depending on what their medical condition is, right? And if they say, no, I can't do that, then you have to let them go. We had a case actually that happened recently where the customer then became belligerent with the staff and verbally abusive. So the manager from the store asked the customer to leave. And then this customer called the police, and the police was like, well, yes, they can't stop you from coming in because you're not wearing a mask, but being an asshole to a staff member is a legitimate reason not to serve you. So too bad, right? And then the other component that I would say is for your contact tracing, if you're doing that in your particular establishment, then taking people's names and numbers, I would make a note on that that the individual's not wearing a mask, and that's to protect your other patrons and staff, right? Because if public health is doing some contact tracing, it's useful to them to know that these are the ones we definitely know did not have, were not wearing a mask. Next question came in for me is, yeah, we're in a ski town and worry that people will come to town not self-isolate first. Oh, sorry, someone say something?
Yeah, I don't know if we're allowed to speak right now, but on the order, like printed right on the order, face masks are not allowed. They're not considered because they have an opening on the bottom, and it's right on the order. So offering them a face mask would not be, like, you would not be following the guidelines.
Yeah, to be clear, we're talking about situations though where people are exempted from wearing a mask, or they're claiming they're exempted. So they're not going to be wearing a mask, or they're not on an obligation to wear a face shield. And face shields, WorkSafe has also said they're not as effective. And it wouldn't meet the requirement of wearing a mask, but this person is not required to wear a mask. So we're just trying to come up with an additional level of security and comfort for your staff and other customers. I mean, it's just a recommendation. You certainly don't need to ask them to wear that, because ultimately they're exempt, right? Arun, did you want to add to that?
No, you're correct. Face shields don't replace masks, but as you're saying, I mean, if they're not wearing anything, then maybe a face shield would be an option.
So this question about a ski town, there's concern that people are going to come and not self-isolate first. Can you refuse entry to anyone that won't answer the question if they have self-isolated or says they don't want to? Yeah, you can refuse entry to people who are violating your COVID safety protocols, essentially, right? I mean, you're saying the reason you're asking these questions is you're trying to ensure that no one comes into your establishment who has potentially been exposed to COVID. And they say, no, I was potentially exposed. I've been traveling and I haven't self-isolated and I have a cough, right? It's like, well, you can't come in today, right? That's a business decision that you can make. Okay, going back to the slides here. An employee tells you they've come into contact with someone who has COVID-19 or someone who has been directed by public health to self-isolate. This is a question we were unpacking a minute ago. Arun, did you want anything to add to this one? If an employee says they've come into contact with someone, maybe their roommate now has COVID-19, and that person who has COVID or has been directed by public health to self-isolate, what should an employer do?
Right. So their direction should come from public health. So the person, when they report to public health and they test positive, they typically ask them about who their contacts were and contact those folks about isolating. So if the particular employee in consideration here is in doubt, then he should call 811 and ask them for direction.
Fair enough. Someone was also asking about the masks again. How do you know if someone is exempt from a mask? You don't know. It's not your job or any logical way for you to make that determination. People will self-declare. And at that moment, you just have to trust them. There's nothing that you're empowered to do in that moment. And there's no, the government's not going to be issuing a formal card or something like that. We cannot refuse them service if they say they're exempt from wearing a mask. Correct, unless you're refusing service for doing something else, right? Way, take it. Okay, I'm going to move on. These are some good questions here. Customer test positive for COVID-19. So this is a customer this time who was in your establishment, and they call you up and say, hey, I was in there on Tuesday night and I've since contracted COVID-19. What should an operator do? We have recommendations in this guide. It's the similar protocol, right? The fact that someone was in does not mean that you have to close. It doesn't mean that you have a COVID outbreak. It doesn't mean anything at all, except you want to make sure your staff aren't exhibiting any symptoms and they've controlled their exposure. So this is the moment where you really underscores the importance of having proper COVID protocols in place, right? Ensuring that you have plexiglass where you need to, your frontline staff are wearing masks, they're controlling their exposure to people being 2 meters apart. If all of those go, then you don't have any additional worries about contracting COVID at that particular moment. Anything you would add to that, Arun?
No, you're right in pointing that out, Jeff, because I would also encourage employers to keep coming back to their COVID-19 safety plan. That's the piece that they have the most control over, and ensuring that everything that's in the plan firstly reflects the reality of their workplace. So that means the plan is suitable to the workplace that they're in, both in terms of identifying some of the risks that come up because of your location, because of the kind of business that you're in, because of the setup of your business, all those things being considered, your best controls for actually managing some of these the COVID-19 risks that come up, and ensuring that those are done on a regular basis, making sure your employees understand what the expectations are, and making sure that they actually follow through on keeping to those regulations that you put in place. So making sure that you're constantly reviewing this, making adjustments as things change, that's the best support that the employer has. And it's your best opportunity to ensure that even if you have a COVID-19 case coming up in your workplace, it does not become an outbreak, or it doesn't cause other people to contract COVID-19 in your workplace. And I think that's the biggest piece. In fact, I was watching a webinar by Fraser Health, in which the medical officer was saying, you said, what happens if you have a COVID-19 incident in your workplace? And she was saying that it's not so much as what happens if there is a COVID-19 case, it's about when a COVID-19 case happens in your workplace. That's because fair. The way things are going these days, especially in certain health regions, this is a higher possibility than you would imagine.
So thanks, Arun. I'm just going to go back to masks again, because a lot of folks are asking questions about this. So let me try and be abundantly clear on this. If someone comes in and says, I don't want to wear a mask, I just don't feel like it, you should refuse them service. They're not allowed to be in an interior public space without wearing a mask. You have an obligation to do that. And if someone says, I have a medical exemption at that moment, then you can't kick them out for not wearing a mask. So unless they give you that valid reason, which is I have a medical exemption, you refuse service to anyone who doesn't wear a mask. As soon as they say it, you say, okay, so yeah, if 5 people walk in, or if a group of 6 comes in and say, hey, we're all medically exempt, well, I recommend them putting them into an area of the restaurant or pub or wherever that's far away from everybody else and has plexiglass barriers around them. And your COVID safety plan should now anticipate how you're serving people who are medically exempt. But yeah, you have to allow them, you have to serve them in some fashion. That can't be the reason you're kicking them out, right? Because they're medically exempt. Sorry, okay. So next one, now some general ones here. What are just a second, sorry. We're getting into the frequently asked question portion of it. So should I divulge the name of the individual who has tested positive for COVID-19 to other employees? I think we touched on this, but Arun, could you unpack that, please?
Yeah, the short answer is no. You do not share any personal information, including the name of the employee, and protect that as much as possible. As I mentioned, privacy concerns override a lot of the other concerns that exist in the workplace. So there's a requirement for employers to ensure that they protect the privacy of any individual who's contracted COVID-19. But having said that, in small businesses, it's difficult to keep it under wraps, but it's important to keep the conversation focused on what your actions are going to be rather than anything related to the employee who's contracted COVID-19. For example, if Susan has contracted COVID-19, it's probably not smart for an employer to go around saying that, you know how Susan is, and you know she goes out partying often, or making any kinds of aspersions on her personal
Yeah, don't make value judgments about your employees like that.
Right.
I mean, make them in your head. Don't say them to other employees. If an employee tests positive. Sorry, someone had a question?
Yeah. You mentioned that you're not allowed to not serve somebody if they said they had a medical. When I read the order and listen to Bonnie Henry, she said that for people that have medical reasons that they cannot wear a mask, they should look at options of curbside pickup, online shopping, or going when nobody else is in that location. So at no point did she say that they should be in, and they should be avoiding then the other people. So at no point does it say that they're still allowed to go into these places. And also my question is, you can refuse service to anyone. Like if somebody comes in and they're only wearing their underwear, obviously you'd be like, you can't come in here.
I'm not sure what your clientele are doing coming in their underwear, Connie. But
no, exactly,
sounds
right?
like a fun pub.
For example, I think like I have put the policy in place that we are 100% mask or no service.
Yeah.
And
okay.
And I don't know, by saying that you're not allowed, where are you getting that? Is like that a government thing, a health thing, or just a policy of ABLE? Like where does that come from?
Yeah, really good question. And thanks for diving into that. I was probably speaking a bit too quickly there. I'm not 100% sure the answer to that. Arun, do you want to tackle it, or although I can get clarification?
No, I'm not quite sure what the requirement is from a customer perspective, how you handle it. No, unfortunately, I don't, Jeff.
Yeah, no worries. I will double check on that, Connie, because in my brain, I'm sure about that, but that doesn't mean I'm necessarily correct on this. So everybody pause on that one, and we'll email you later today with the answer for it. If an employee tests positive, do I have to report it to the federal or provincial government? Arun?
There's no requirement from an employer's perspective to report anything to either the provincial or the local health authorities. Usually when a person reports positive, that comes up at the health authority, and contact tracers get involved, and they start tracing some of the contacts that the person who's tested positive has had. So these would be personal contacts. These would be contacts at at the workplace, any other interaction of any extended nature that they've had in their past, I think, week to 10 days is what they look at. So there's no reason for an employer to contact the health authorities except to provide maybe additional information about the kind of interaction the employees had at work. If they feel that it has or it has not been conveyed adequately by the employee concerned, they can probably call their health authority and share with them some of the details around the workplace environment where the employee was working in, and the people that that particular employee was working closely with, to help them with the contact tracing efforts. So in that sense, that's the extent of the information that they need to share to the provincial government or the health authorities. Sorry.
Excellent. What medical information am I allowed and not allowed to ask my employees? So you're not allowed to ask them about their COVID tests, but what are you allowed to ask?
So the medical information, again, is fairly tricky. Typically, employers are not privy to medical information about the employee, except in as much as what the prognosis is, not so much what the diagnosis is. So you're not, for instance, allowed to ask what's wrong with the employee, but you may be allowed to ask if the employee is fit to come back to work, if their doctor or the health authority has cleared them to come back to work, they're safe to come back to work, what kind of work can they do or can't they do because of any kind of ailment they may have had, whether it's COVID or anything else, about how it impacts their work itself, but not specifically related to the condition that they're in. Also, the health questionnaire is a form of asking for personal information. So those are things that should be treated as confidential information, and they should be kept in a way that private information is stored. So you're now asking employees whether they've had symptoms. Some employers I know do temperature checks too. So if you're doing temperature checks, then are you holding on to that information? If you are, then are you storing it the way it should be? So potentially, if you're collecting any such information, it is important that you store them carefully and you only collect information that you really need to collect.
That's a really good point, Arun. And I hadn't thought of that earlier when we're talking about the employee health checks that you're doing every day, that you keep that information confidentially. Right? Can we ask an employee who's been tested to share a copy of their test results before returning to work? I think we probably know the answer to that now, right? But where you're coming from is how do we protect the rest of the staff in case the employee is not being truthful about returning to work? This is a tricky question right now, Arun.
So I guess the same the same requirements apply, and the recommendation from the health authorities to not ask for these, not ask employees for these checks, because they say that when an employee reports positive, they have very specific guidelines for what the employee or for what the person is supposed to do, and they are very clearly told when they're supposed to go back to work. And a lot of the health authorities are actually mentioning that they are not going to do a test at the end of that period. To ensure that they're test negative. In fact, so much so that at the webinar that I was in, the health officer from Fraser Health was saying that, if you do a test at the end of the isolation period, they could very well report positive, because sometimes there's remnants of the virus in the bloodstream, but that doesn't mean that they can infect others. So they feel if you go through the period that they recommend, then the employees are safe to get back to work, and they give very, very specific recommendations to people about when they are allowed to return to work. So that should suffice.
That's good. Can staff question a customer if they think the customer has COVID-19 or is displaying symptoms? So the customer is sitting in the corner coughing or whatever and displaying what could be symptoms of COVID-19. Or is the staff or manager allowed to ask them?
So I would approach this slightly differently. Actually, it's not a question of questioning customers as much as not allowing customers in with symptoms. So this is something that you probably have as policies of your business, and these are probably displayed in signage, that you will not allow people who have symptoms to enter your premises. So this is only reiterating or reinforcing that rule that you have for your business, and making sure that you do that check when people come in, and your staff are trained to spot people who have these symptoms. And it's hard to say whether it's COVID-19 or if it's something else. So staff are not expected to interpret these symptoms. We are just going on the assumption that if you have any of these symptoms, it's not safe for you to come in. Maybe you could offer them takeaway or any other options that you may be able to offer. And also, you should realize from a customer service standpoint as well, you have other customers in your premises who, if they see people with symptoms, they're not going to feel very comfortable either.
On this topic, or on a slightly different topic, there's a few questions in the chat, and I will come back to some of those folks. But Tam is saying they had a positive case in the workplace, and while they have a solid plan in place, when the other employees found out that it happened, not who it happened to, there was a mass exodus. How do we deal with this when employees are scared, but you still have to run a business? That is a difficult reality of the universe we live in. Yeah. Arun, do you have any thoughts on that? Oh, you're muted, buddy.
Sorry, I keep switching back and forth, and
I appreciate that.
lose track. So again, it's coming back to what you do to make sure that the workplace is safe. And I get it that not everyone may accept it, and people are generally running scared in the environment that we're in. So this is it's only the best that you can do under the circumstances, and that again involves going back to your COVID-19 safety plan, the effectiveness of that safety plan, how well you've considered controls within your workplace to keep your employees safe. What may be some of your other businesses in your area, or people you think maybe larger businesses, maybe folks who have a little more experience in doing this, have to say about it. So anything that you can do to make sure that the protocols that and the orders that are guiding you in these circumstances, making sure that you're in compliance with that, and more than anything else, having that constant conversation with your employees to be telling them about all the things that you're doing, about how they can help, and maybe even soliciting some information from them in terms of what you could be doing better, or if there are areas that you've not considered which you should consider. So essentially, it's a question of sharing that you're all in this together. We need to find a way to deal with this where we are. That's the best advice we can give at this stage. There's unfortunately no magic bullet here that can alleviate some of these concerns.
On that last point you're making, Arun, I'm going to unpack that just a little bit more later on, but underscoring, I think partly what you're underscoring, I'm trying to say, is the importance of communicating very clearly and proactively with your staff about these, and we have some tips on that. Someone was asking in the chat if we have a sample of like a worker health check. I think Danielle is putting one out there for folks. We'll also make sure we send it to you after. What if an employee refuses to work because they don't feel safe? They're saying, I'm terrified of COVID, or we had a COVID outbreak or whatever. And what if an employee raises concerns about unsafe work because of COVID-19? So those are similar questions, but slightly different emphasis, right? So Arun?
Yeah, so there are a couple of issues here. So the right to refuse unsafe work is something that's enshrined in the Workers' Compensation Act. So workers have a right to refuse unsafe work. But what does that mean? So that's not a general feeling of being unsafe in an environment. And that is something I guess all of us are dealing with. Whether you're going to work, or whether you're going to buy groceries, or going out to eat, or going to work. So whatever scenario, I mean, people are generally feeling unsafe under the current circumstances. So that general feeling of being unsafe is not covered by this. What is covered though are specific cases where they identify practices that they feel are unsafe. So if the work that's being carried out itself and the way it's being carried out is not safe in their eyes, then that is something that requires a level of investigation. For instance, if they say that the people in the kitchen are not wearing masks, they're working close together and they're not wearing masks, there's not enough physical distancing, hygiene is not being observed, so I don't feel safe to come into the kitchen. Now that is a very specific allegation which needs to be investigated. And if there are gaps in terms of what the requirements are from a safety plan perspective, then the employer needs to make sure that they address that and they fix the issues that have been highlighted. And once they do that, they need to share that with the employee. Now, if there is no specific allegation, or if there is an allegation and you've done what you can to fix those issues and the employee still insists that it's unsafe, then the employer would require to contact WorkSafeBC, who then gets involved in evaluating whether there is any merit in the claim that the employee is making. So they will probably conduct an investigation or an inspection, either physically or by talking to you, to understand what the situation is and what you're doing to address it, and then make the decision. So then the decision lies with WorkSafe to determine whether it's safe or unsafe. And if they deem that it is safe, then the worker does not have a case in this matter.
Okay, so you're saying if they come to you with a specific allegation and say, no one in this place is wearing masks, then you're obliged to sort that out. And if they say, okay, everything is fine, but I just don't feel safe, is it the employee's or employer's responsibility to consult with WorkSafe?
If it is a general statement about being unsafe, then the employer really doesn't have anything to investigate. You cannot investigate a general allegation, so you'll need to ask them to get specific. But if,
the probe. Yeah.
as far as reaching out to WorkSafe is concerned, it is the employer's responsibility.
Okay. So, and that would happen in cases where they say, you can imagine this, right? It's like, I just don't feel safe. And you're like, okay, I can't do anything about that, which is something specific. And they say it's because your mask policy. I'm like, well, everyone here is wearing masks. So I think I've resolved that. And at that
Correct.
point, the employee says, I still just refuse to work because I don't feel safe. At that point, would the employer say, I'm calling WorkSafe then to sort this out? Is that
Yes. So,
okay.
So that's one option. The other thing also is, we stress, especially in these circumstances, is, people are dealing with a lot of things that you may or may not be able to see in their personal lives. I mean, there could be, people in their family who are, who have conditions that are, causing them concern. It could be anything else. I mean, that you're not particularly concerned with. So having that conversation and to be able to understand where the concern really lies is really important. And I'd like to underline that more than any kind of action-oriented, initiative, to try and understand what is actually causing this concern. But for sure, to underline that there's no blanket protection that the employee needs to have in terms of feeling safe in general. But employers need to do specific things.
Yeah, I think that's a good answer. Do I need to pay my staff if I temporarily shut down because of COVID-19 outbreak? And is there government support I can direct them to? Well, there's definitely government support you can direct them to. We have other webinars. I think Restaurants Canada has done one as well recently about employees' options. There's tons of information available about that online. But do you need to, sorry, I hope you can't hear that noise outside. I'll close my window while I'll run you answer the first question.
So there's no, the short answer I would say is no. I mean, under the circumstances, especially if you're asked to close by public health, I don't think there's a requirement for employers to pay compensation. And yes, as you outlined, there are enough government schemes available to support employees in these cases. But this, in many ways is like the challenge that we encountered earlier on in this epidemic. So this would essentially constitute a layoff. So potentially as far as the regulations go, layoffs are not allowed unless you have the consent of the employee or you have it in your employment contract. So potentially there is a possibility here that at some point there may be a case related to this. But from my talking to employment lawyers, I understand that there's really, most times employees accept that, this is being done for a valid reason, if it is, and if that's what is being done because of if there's an order, of course, there's no question of there's a requirement based on outbreaks in your workplace, you're doing this. So there's a valid reason for them to do it. So they usually go, to EI or anything else that they can get support for. They don't really follow the route to litigation or, complaints. But so there's not been any evidence of that happening. And with all that's been going on, I guess, in the context of all that, I would say that if there's an order from, to close down, the employer should not be on the hook.
Yeah, and I think also if you are just temporarily shutting down for a few days voluntarily because you've had a COVID situation, you're not obliged to pay staff for when when they're not working. That's just scheduling, right? I want to go back to the previous question, Arun, just to make sure we're clear. So this from the fine folks over at Brewery Creek saying, so if employees A, B, C, and D feel unsafe working with employee E because that, or, say it's me, right? So we've got 4 people who don't want to work with me because I, outside of work, and don't give a crap about COVID, and I'm partying with my friends, violating protocols, and they know that about me. What steps can the employer take, if any?
Employers' ability to control employee behavior outside of the workplace is limited. So it's a little difficult to actually be able to do something about employees' behavior outside the workplace. But having said that, these are situations that can be addressed for instance, in staff, briefings. So you may not talk about a specific case or the specific employee, but you can talk about specific behavior or specific actions that can cause a significant impact on coworkers and the safety of the others in the workplace, and to ask employees to desist from doing it. So I think in that sense that so you can be seen as addressing the issue, but at the same time you're not actually calling that employee out specifically, to say that they're doing something that they're not supposed to be doing, because that gets into a slightly difficult scenario for employees. How did you come about that information? How reliable is it? Is it specifically related to their behavior, or is there something else at play? So this puts the employer in a difficult spot. But to be able to address this regularly, on an ongoing basis, in staff briefings with staff, again, underlying the fact that we're all in this together, what we do outside of the work also impacts the people who are at work, and how this works both ways, not only for them, but also for the others in the room. So that's the kind of communication that I would recommend that employers keep having with their employees.
Yeah, it makes sense. I had this conversation with a member recently, and they've been trying their best to handle it through staff meetings and say, you can do whatever you want in your personal life. That has nothing to do with, like, he has no control over that. But ultimately, their ability to remain open and keeping people employed depends on having, not having the virus inside, which is why they have all these protocols in place, and everybody's working really hard to keep everyone safe and healthy. So think about your personal life, right? So that you don't bring the virus into this and compromise the employment of all these other people around us and compromise the business viability.
And if I may add there also, if you have good protocols in the workplace about working safely in terms of the controls that you established, that would also be another layer of protection for employees. So if you're making sure that you're, using proper PPE, if you're making sure that you have, hand hygiene, you're making sure there's physical distancing, those also account for a layer of protection for everybody.
That's a really good point. Yeah, I think I really like that you keep coming back to that, Arun, because those health and safety protocols you have in place are really, really important, and we'll talk more about them in a few minutes too. What does COVID-19 leave? Not when does it leave, because that's going to be sometime next year at best, right? But what is the leave provision?
So COVID-19 leave is this unpaid, unlimited, job-protected leave. And there's specific reasons why or when they can actually avail of it. So if someone has been diagnosed with COVID-19 and has been advised by a medical health professional to that they've tested positive, so they are in quarantine or in self-isolation in accordance with a provincial health order or part of the Quarantine Act, in case they're coming from, say, from some other jurisdiction, or they've been traveling somewhere. If their employer has directed them not to work because they have a specific concern about their exposure to someone else who's had COVID-19, then if they've had if they have a minor child or a dependent who they need to take care of, and there is a COVID-19 related reason there, including school closures or no daycare availability, and if they're outside of BC, outside of the country, and are unable to come back to work because of border restrictions. So all these situations are covered. There is no limit as to how long this can be taken for, and essentially they get EI related payment for this.
Yeah, the point to be clear for all employers: it is unpaid leave. This doesn't cost you money.
No, it doesn't cost employers anything.
For a while, right?
Correct.
How do you suggest we review and update our COVID-19 safety plans following a case or outbreak in the workplace? This is an important one, and everyone, you probably should take a couple seconds to unpack this. And I also, I know that you have a lot of expertise looking at different COVID safety plans. Can also people ask your support to review their existing plans? I mean, if you could explain, that'd be great.
Absolutely, and I'll take the second question first. So we are happy to support any employers, in your membership. We'd be happy to review their safety plans. If they have any questions, they can contact us through you, maybe, or they can send us an email, and we will help them review their safety plan.
That's great. You'll get both my email as well as Arun's after this, by the way.
Great. So the other piece about reviewing safety plans, if you have an outbreak, so my first reaction to that would be, this should not happen only when you have an outbreak. There should be a regular pattern for you to review your safety plan at intervals that you determine beforehand. So this could be based on any new orders that come out, maybe. So any new restrictions or requirements that come into play. It could be, for instance, the requirement to use masks, the requirement for the daily health check. So all these need to be included in your safety plan, and they need to be updated. The second piece is to keep looking. Sorry, I got some feedback.
Okay.
So the second piece would be in terms of looking at the risks in your workplace. Has anything changed in your workplace that may need you to revisit your safety plan? Have you hired any additional staff? Have you trained those staff in your protocol? Have you brought in any new processes or any new equipment? Have you changed any work patterns or shifts? Any office or workplace configurations have you changed in terms of how your place is set up? So this may actually impact, physical distancing. This may impact, your ability to the number of people to be able to be in one particular place. So anything that impacts or has changed in your workplace needs to be considered when you're reviewing these plans. So doing these reviews on a regular basis, whether it's a weekly review, whether it's a monthly review, it's also important to solicit information from your frontline staff, people who have who are constantly out there dealing with your customers. If they are seeing something that you're not, or if they feel there are parts of the plan that are not adequately addressing some of the risks that are coming up, then that is something that needs to be looked at as well. And to underline here, WorkSafeBC has significantly stepped up their enforcement of these safety plans. So it's very likely that you may get a visit from a workplace BC inspector or a provincial health inspector, and they've started actually penalizing workplaces for insufficiency of these plans, either if they're not current, or if it's not enough to address some of the risks, or if it is not being implemented properly.
Yeah.
So a lot of times we see that too. Employers often look at only the regulation side of it when a safety plan is being reviewed. So it's not only the regulation. Yes, you need to follow the orders, you need to follow WorkSafeBC regulations, but it is also important to keep in mind the health and safety of everybody in the workplace and the risks that are actually affecting them. So, it's important to not lose sight of that when you're doing the review of these plans. So it's important to consider all the elements that I mentioned before when you're doing that review. And as I said, we'd be happy to support in any such review.
Thank you, Arun. Really underscoring the importance of making sure your plans are up to date. And by all means, guys, take advantage of Arun's offer there. Just have a glance at the plans. Okay, so how to move forward all right, after an outbreak, right? So this is a bit about the communication, but we'll come back to some other questions for you, Arun, in 2 seconds here. Let me just make sure we've answered all these. Can we ask employees to share a copy of their test results? We covered that. Violating orders outside of hours. What's the definition? If the kitchen and serving staff are wearing masks and doing their best to socially distance, will they be considered exposed and required to isolate if a coworker tests positive? I think we've covered that. If they're not experiencing symptoms, they don't have to isolate, but if they have potentially been exposed, even while they're wearing PPE, they should consult a healthcare professional and call 811 and get their recommendation. Someone was asking how long, once you call 811, how long before an individual gets tested, how long till the results come back. If they test negative, can they return to work right away? If they have symptoms, they have to isolate. Okay, so on some of these I can answer out of personal experience. I got contacted by public health a couple of months ago now and said that they had done some contact tracing on something. I got caught up in that. So they said, was I experiencing any symptoms? And that particular day I happened to have had a sore throat or something, I forget what it was. Like, well, I'm experiencing this, which I just thought was, my hangover or something. I didn't realize, but they said you should get tested. You can go online and look at where testing centers are at. I drove to North Vancouver, went through a drive-through testing center later that afternoon, and I had results back within 23 hours, I think, of it. So it usually happens fairly quickly. And that may not be everyone's case, but that's an example of it.
I have to chime in there and say it's very specific to the health authority that you're in. I know that there's some delays in the Fraser Health region now. Yeah,
fair enough. That's a good point. Okay, so if this happens, and what do you do in this? So I've got some little advice here for how you communicate. And first off, so if your staff, there's a potential COVID outbreak at your place, right? And you have to communicate with your staff. There's some simple principles here, like be kind throughout this, right? They're looking to you for leadership in this moment. It's important that you express sympathy with anybody who has tested positive, right? And we've got some samples of the kind of language you can use, which we'll be circulating. You want to clearly communicate with them that you're supportive, right? You have to be proactive in alerting others in your workplace, right? You find out, okay, you worked with these 3 people closely. I have to now go contact those 3 people. That's your obligation. Don't wait for public health to do this. You have to alert them that they potentially come into contact and they should reach out to public health. And we have sample communications for that as well. Be calm and consistent throughout this process, right? This is going to happen to you at some point, right? Have your senior managers, if you can't do it yourself, check in with the other employees and say, okay, guys, we found out there's a potential exposure. We've contacted them, and then we've contacted everybody who's been in close contact with them. That's all being handled. If you haven't heard from us, it's because you were not in close contact with that person. We're doing everything we can to keep you safe, right? And the fundamental message you're going to be delivering throughout all of this, it's like the first feeling that you're giving them is, we're doing everything we can to keep you safe. Your health and safety is of paramount importance to me right now, right? That's what they need to hear from you. And then be inclusive. After you go through all this process with them, give employees an opportunity to raise concerns. Be like, okay, so we knew it was going to happen. It happened to us. Let's have a virtual meeting to talk about, your questions. If we can follow up with written emails and saying, how are we feeling about our protocols here, right? And then you can go through it with your employees. Make them part of the solution. Because the worst thing for you, and what you definitely don't want, is one of your employees goes home and is talking to their roommate or their friends and be like, did you hear about Danielle's bar? They had a potential case. They didn't do a goddamn thing. They didn't give a crap and all, and that's not a safe place to go. And that is going to damage your business. This is not just being a good person. This is protecting your brand, right? And the brands that are doing well in this environment are the ones that are clearly indicating that they are taking the health and safety of their employees and their customers safe. So I would recommend doing all of that. Yeah, and with your messaging, and I'll give you a chance to add if you have anything here, Arun, but be frank and honest and open with your staff, right? Now, with the restrictions that Arun has put in place around privacy issues, just tell them what's up. Ensure your staff are okay, show them that you care, remind them that they are safe with all these protocols, right? Because we know that you're not manufacturing it in your secret, underground lab. There's probably somebody else that brought this in through their social circles, right? And then, yeah, those are the ways that you can to have the communications with them. Anything from there, Arun, that you want to highlight or disagree with me on? Feel free to add.
No, I think you've laid this out very well, Jeff. And I just wanted to underline a couple of things. It's essential. It's essential that it does not become an us versus them kind of scenario. So it's everyone is in this together. So maintaining that tenor in everything that you do or everything that you communicate, I think helps set the stage for not only making sure that you're addressing all the issues that need to be addressed, but also making sure that you are getting commitment from your staff. It's not just compliance. You don't want your staff only to comply. You want them to be committed about doing all the things that you're doing to ensure that the workplace is safe. And the other piece that's increasingly coming about, and I know all of us have experienced this ourselves, are the mental health issues around this. So, this is having a huge toll on people's mental health. I understand this from your own perspectives as owners, the challenges with dealing with this, your finances, your business outlook, safety. I mean, I know that the plates are just overflowing, but I think that's happening for more folks than we realize, and people are probably not being able to handle this very well, but are not necessarily talking about it. So making sure that we create a safe space for our employees to be able to talk about it, even if you may or may not be able to support them beyond the point, the fact is you're at least giving them an opportunity to be able to speak to everyone about it and make them feel better just for that.
Thank you. So the next one is how do you communicate with your customers? And this kind of goes back to where I'm going with this, and I think I maybe didn't lay this out properly earlier, but so if you've had a potential exposure, right, or even if you've had a customer or an employee who contacts you and says, hey, I had COVID, right? So the first thing to know is, question is like, are you supposed to close or not, right? So the real answer is, you do not have to close unless you were ordered to close by WorkSafe or the public health officials, right? So potential COVID exposures, low risk or outbreaks are a fact of life, and they know that. So they're not going to say close because someone walked into your place with COVID. You also have no need or no obligation to advise your customers that somebody came into your establishment and had COVID. I'm not suggesting you do it or don't. That's your decision, how you run your business and your brand, but you're not obliged to do it, right? So that gives you a moment to think about it. You definitely should do everything we just talked about with staff, because that's just being a good employer in this environment. So if you are temporarily closing from it, we have in our COVID safety package you'll be seeing after, we've got some suggested message, which again starts with that top line. We take the health and safety of our staff and customers very seriously. You know, we've heard reports that this happened, so we're temporarily closing out of an abundance of caution so we can completely clean and sanitize the place. And then we have another message after that when you're back open and say, hey, we took care of everything. It's because we closed proactively, even though we were not ordered to because we take your health and safety so seriously, but now we're open and here's the protocols we have in place. So the fundamental thing you're doing in both of those, right, is reminding customers how you're keeping them safe, right? So if you're closing because something happened or reopening, your message including in there will be, we care about your safety. Here's how we're keeping you safe with our COVID safety plans. You can often throw in there as well, just to give additional security to folks, that you are working with WorkSafeBC and public health officials to ensure that customers are maintaining safe the whole time. So we have the templates. We have sample messaging to customers, establishments temporarily closed, sample messaging to customers that you're now reopened, sample messaging to employees that we've had a potential infection in the workplace, and some guidelines on how to speak with an employee who's tested positive. And to their close contacts. So we're going to email all that to you afterwards. You essentially have scripts you can work from. They're not cookie cutter, one size fits all. You know your business and team far better than Danielle and I do, but it'll give you the start that you need. Anything you'd add to those things, Arun?
No, we have a page on our website as well where we talk about how you maintain your safety plan. So the COVID-19 safety plans. We got a lot of resources in that can help employers as they go through this process. And as I said, we are open to talk to employers if they need specific advice.
Perfect. Before I go to my next portion, I just want to go back to the chat for a couple of questions. And thanks, guys, for answering each other's questions and contributing in there. Imraz was asking, so if an employee is diagnosed with COVID-19, they're not allowed to come back to work until they test negative or until they're no longer exhibiting symptoms. Can we ask that employee if they have tested negative when they come back to work? And I guess it's like, or do you just say, they contact you and say, hey, I'm able to come back to work now? Like, how do you navigate that process, right?
So I was mentioning this earlier as well. When I was on this webinar with Fraser Health, they specifically said that they're not required to do a test at the end of that period to say that they're negative. Once they do the positive test, they are asked to stay isolated for the period that they're told. And I believe most recently it was 10 days of isolation, post which they're cleared to go back to work. So they give them specific directives about that, but they don't necessarily tell them to do another test.
Perfect. So before I get to that, I want to go back to that mask issue again. And we were talking about, are you allowed to refuse service if somebody's not wearing a mask? And the answer is you are obliged to refuse service if someone's not wearing a mask. And then I was confusing everybody with my answer about if they are medically exempt, right? So we covered a bunch of that, but Kaylee had reached out directly to ServiceBC, and we'll confirm all this, but I'm just going to read Kaylee's information because I think it sounds accurate to me and it seems valid here. So, are you legally allowed to ask for written proof from a doctor? ServiceBC said you're not allowed to ask for a doctor's note or proof of medical exemption. Are they legally allowed to refuse, or are you legally allowed to refuse service to these exempt patrons, regardless of written proof or not, right? Because you're not going to have written proof. And ServiceBC says you are allowed to refuse service if someone refuses to wear a mask, provided that it is a store policy or business policy or part of your COVID-19 safety plan. So that's interesting. So put it into your safety plan that says you do not serve anybody who is not wearing a mask, and that allows you to refuse service in these cases. And then they go on to say private businesses are still independent and do not have a duty of service. Thus, they're legally entitled to refuse service. And this is where I think I was maybe a little confused earlier because, there's people have, no one has successfully said that being refused service because they're not wearing a mask is like a discriminatory practice, but that's where my brain goes. But ServiceBC is saying that you're legally entitled to refuse service in that case. How should the employee phrase their response? I recommend telling the patron that while the province recognizes mask exemptions, private retailers or restaurants, pubs, hotels, and other establishments are under no obligation to offer service to people that do not follow their store policy or their local policy. And that's when you could also say, well, we're happy to provide takeout and delivery, etc. services to meet your needs in this case. I think that all sounds more logical than I was yammering on earlier. But Arun, does that make sense to you? Would you add anything to that? You good?
No, I think it does. I think it covers.
Perfect. So at this point, I know we're slightly over time. I'm going to wrap this up, guys. And this is the slide where I make a naked, blatant pitch for why you should be a member of WorkSafeBC. And there are a lot of benefits to what we do as an organization, but obviously the primary one is our advocacy and our ongoing relationships with government. And look, if you're not a member, I get it, right? Why spend the money? Until now, it has been easy to enjoy the benefits of our advocacy work, whether or not you have paid a membership fee. But that's fair, because our work benefits the entire industry. Things like the fact that liquor primaries are getting wholesale price instead of hospitality pricing, right? Or further hospitality pricing, things like that. But I would ask you to ask yourself, like, what would have happened over these past several months if WorkSafeBC had not been here, right? If we had not been here to have your back. And would that have been worth saving $67 a month or $800 a year? Because that's what we're talking about. So I'm mentioning this because to continue the work that we do, we need our industry support. We're a not-for-profit society, and your membership is our primary source of revenue. We are industry and a reflection of industry. So we're clear that working for you is our only purpose. And I don't know how you feel about it, but I know I feel, and I know Danielle feels very strongly, that the work we're doing has never been more important, necessary, or vital. And we feel a real strong responsibility to do it well. And I just say personally, I'm proud that over the last 6.5 years doing this job, that I think we've really earned industry's trust. We have had your back. And as much as I hate to ask, if you're able, we would really appreciate it if you had ours during this time. So sign up, and that way I don't have to harass you guys about membership anymore. Here's the kind of stuff that we do for your membership, which I won't trouble you around now. I think a lot of you know, with the liquor policy work, we're your voice at every level of government. We work hard to hear directly from you. We have an elected board of directors that come from the membership. They hire me. They govern the organization while I take care of the day-to-day stuff. We have conferences and Zooms and happy hours and things like this to hear from you and to answer your questions. And then, we have other programs that benefit things, which we won't get into today. And then also can set you up with this kind of information when you need it. So with that, unless there are any final questions, I really appreciate you guys taking the time to listen to us today. I think Danielle has thrown her email in the chat. You're going to get an email from Danielle shortly with a copy of this webinar, my contact, Arun's contacts, and the COVID guide that I was talking about throughout this. Any final comments, Arun?
No, but I think that's it. Thank you for the opportunity. And yes, Jeff, if I could throw in there too, I appreciate all the work that Abel has done. I've seen you do this for a while now, and I think you bring a lot of passion and perseverance to this. So good work.
Thanks, buddy.
And we're happy to partner with you and support you in any which way we can.
Amazing. Well, thanks very much, guys. Have yourselves a wonderful day. Stay safe and sane out there, and we'll catch you soon.
Bye.